Hi, everyone. Good afternoon or good evening, depending on which part of the country you're joining us from today. I'm Vicki Goodman, and it is my pleasure to welcome you to The Open Mind, a lecture and film series that brings together thought leaders at the intersection of science and culture for meaningful and relevant programs about mental health issues. The Open Mind is proudly sponsored by UCLA's Friends of the Semel Institute for Neuroscience and Human Behavior and the Resnick Neuropsychiatric Hospital Board of Advisors. Today, May 1st, marks the beginning of Mental Health Awareness Month, a moment to reflect on how we prioritize mental health in our lives and in our communities. And I can't think of a better way to kick off this special month than by welcoming Dr. Debra Whitman, author of The Second 50, Answers to the 7 Big Questions of Midlife and Beyond. Dr. Whitman is someone who has dedicated her career to improving the physical and mental health and well-being of our aging population, so very appropriate to start Mental Health Awareness Month. Dr. Whitman is a leading economist and a global aging expert. She's the AARP Executive Vice President and Chief Public Policy Officer and former staff director for the Senate Special Committee on Aging. In her new page-turning book, Dr. Whitman outlines the challenges and solutions to both personal and policy-focused issues to support America's aging population. And I would also like to let everyone know that Dr. Whitman is generously donating all proceeds from the sale of The Second 50 to support the AARP Foundation. It is also our honor to welcome back to the Open Mind Dr. Helen Lavretsky, who will join Dr. Whitman in discussion. Dr. Lavretsky is a professor of psychiatry in residence in the Department of Psychiatry at UCLA, and she's the director of the Late Life Mood, Stress, and Wellness Research Program at UCLA. On behalf of the Friends and Resnick boards, I would like to thank both Dr. Whitman and Dr. Lavretsky for taking the time from their busy schedules to educate us about healthy aging. I've abbreviated their bios here in the interest of time, but I encourage everyone to read more about these preeminent, accomplished health science leaders. A few housekeeping notes before we begin. Today's program will run for approximately 1 hour, with the last segment reserved for your questions. If you would like to ask either of our speakers a question, we ask that you please type it into the Q&A, which is located at the bottom of your Zoom screen. At last check, about an hour ago, we have over 1,949 people registered, but then again, who's counting? We appreciate your patience, and we'll try to get to as many questions during the time allotted. Today's program is being recorded. It will be available for viewing on our website, friendsofsemelinstitute.org. There you will find videos from past events, information about our Friends Research Scholar Program, and a calendar of upcoming programs. There you will also find information about the Open Mind Film Festival for high school students that took place this past Sunday. In case you missed it, I highly recommend that you head to our website to see the powerful and poignant films about mental health produced by high school students from throughout the country. And also on our website, there is information about our Teen Advisory Council, which I'm excited to announce we just today opened applications for the 2025-2026 Teen Advisory Council cohort. So if you know any high school students in the Los Angeles area interested in mental health or neuroscience, I encourage you to invite them to visit our website and fill out an application as soon as possible. We fill up very quickly, and we would love to have high school students dedicated to mental health join the council. So now let's all get a little smarter and learn about aging well. Please join me in giving a warm Zoom welcome to Dr. Deb Whitman and Dr. Helen Lavretsky. Thank you so much.
Hello, Deb, and thank you so much for sharing your wisdom with us.
So happy to be here, Helen. Thank you for joining me.
Yes, I've read your book. It's very informative, very dense in information. What why did you write it, and what surprised you in the process of writing it?
So you heard Vicky talk about all of the work that I've done from my career working in the Social Security Administration. I ran the Senate Aging Committee, and I've been here at AARP for 13 years. And so even with 25 years of working on aging issues, I realized that when I was about to turn 50, there was just a whole lot that I didn't know. And I looked on my shelf and I looked for a book that would tell me what's going to happen in this next phase of life. And I had What to Expect When You're Expecting from when I had my kids. They were about to head to college. Actually, my daughter went to USC out in LA. And so I had a whole bunch of books about going to college. I had books about my career, but I couldn't find one that really covered the whole breadth of things that I was going to face in the second half of life. And so I wrote down the questions that I was curious about. Things like how long will I live and will I be healthy? I wanted to know practical things like will I have enough money or how long will I work? I also wanted to know some scary things like will I lose my memory and even how will I die? So I wrote those questions down and those became the chapters of the book. I dove into the research, learned a lot. There was a lot that I knew, but it really turned out there was a lot that I didn't know, particularly the why behind things. I interviewed experts. We did a poll across the country so I could really understand what people thought of the second 50 when they're in the second 50. And then I interviewed people all over the country to get their stories. So it was a great learning exercise for me. Hopefully, others will find use in exploring what the second 50 might mean across this country, but also for themselves.
So what did you learn about what an individual can do to live a longer and healthier life and expand their lifespan and health span? That's your chapter 1 and chapter 2.
So this is the question that I get most often. Everybody wants to know, what can I do to live a longer and healthier life? And there's so much information bombarding people. What I found the most clear information was the most simple solutions. So the strongest piece of information of data that I could find is there's 5 healthy habits. And if you do all 5, you live longer and healthier by about a decade. And none of these will probably surprise anybody who's listening. They're the things you've been told over and over again by your doctor. It's things like eating right, eating a healthy diet, exercising regularly, making sure that you maintain a healthy body weight, not smoking, and not drinking too much. So all 5, if you do them regularly, will get you about a decade of life expectancy on average. But even if you do one, that will give you an additional year. But Helen, I think what also surprised me was there's really good research about our sense of purpose, our mindset, and our relationships. And so I think I'd love to walk through each of those a little bit too. I interviewed Bob Waldinger, who runs the Harvard Study of Adult Development. And this is a database that has answered, people have answered questions since they were children all the way up until their 80s and 90s. And he looked at the healthy 80 and 90-year-olds and saw that what was different about the healthy ones and the unhealthy ones was really the quality of their relationships. So he looked back at age 50, and those that had better quality relationships actually lived longer and healthy life. That's really meaningful to me as I think about my own future, but I think important for us to talk about. Another piece of research that I found was from Dr. Becky Levy at Yale, who has looked at how our mindset impacts our health and longevity. And so I can't ask participants to raise a hand, but maybe you can do a clap. If you think about the first word that comes to mind when you think of an older person, Just take a minute, and what's the first word that comes to mind? Now, give a clap or a emoji if you can. If not, just smile, because if that word is a positive word, you actually live 7.5 years longer. So if we think that aging is a time of growth and opportunity, we live longer and healthier, or we have a lower risk of heart disease. We actually have higher brain volumes. And her data really has held true across different populations and many, many studies. So if I was going to give the list, it's those easy, healthy habits. And I'm not going to say easy because I didn't, I may not eat healthy every single day or exercise every single day. But working on your mindset and your relationships is something that we can do.
You mentioned that one of the dreaded effects of aging is losing your memory, losing your mind. So your third chapter talks about brain health and mental health. What can individuals do to improve their brain health and reduce their risk of dementia?
So one of the biggest fears that people have about growing old is getting cognitive decline or dementia. And so I wanted to understand um, what the prevalence was and what really if people could do anything about it. And I think so many people think it's inevitable as we age, and it's inevitable for each of us. But we can lower our risk for cognitive decline and dementia by doing many of those things I just said were true for healthy aging. A couple others that are important are things like making sure you use your mind. Doing cognitively stimulating activities, as I'm sure you refer to them at the center, but being sedentary and not using your brain is really bad for its health. The other things I mentioned, like exercise and diet, are also important. Um, Sleep is important, not getting too much or too little. Making sure you have your hearing checked, because people who don't use hearing aids have a much higher risk of cognitive decline and dementia. So there's a lot that we can do to lower our risk. That doesn't mean that nobody will ever get it ever, but the goal is to delay as long as possible or avoid it altogether.
One of the questions participants asked was about depression, whether it gets worse with aging, and in general, mental health. Older people struggling with mental health. How are they different from other Americans, and what can
Oh,
be done to help?
Helen, you're the expert on this. Why don't you jump in since
Well,
given
I
your
did say
background?
that yes, we do have effective treatments even for people who are older, but there are some circumstances that are associated with aging, like medical illness, for instance, or cognitive decline, that may complicate treatment of depression. However, treatments are available, and it's the access to mental health care, appropriate mental health care, that is in question. And sometimes social determinants of health or social drivers of health that you talk about might influence this access to care.
Yeah, one of the things that really shocked me. So, the reason I'm working on aging, I think, is because I grew up with my grandmother. Um, and my mom was her caregiver for over 50 years. And my grandmother Margaret had schizophrenia. So we had a very close relationship. She was kind and loving, but it also exposed me to people that have health issues, and particularly mental health issues. The need to make sure that they are loved and safe and valued in our society. And that really put me on the career. So I touch a little bit on mental health in the book. One of the things that really struck me was the incredibly high rates of suicide, particularly by older men. In fact, the men over 75 have rates twice as high as teenage boys. And we know that that is a tragedy in this country. And so I really encourage people to seek out treatment, as you said, Helen. There's treatment that's available and that can be helpful for people as they age.
So you're the economist, right?
I am,
That's your background.
which is why I have to use a lot of data and figures. I'm sorry, everybody. I can't help myself.
And so one of the dreaded perceptions of older adults, especially in the society, is that they're a drain on the economy. And you argue that they have a powerful and positive impact. Why is this?
Well, more importantly, we're going to need older people in this economy. So first of all, we often refer to older people as dependents, as if they contribute nothing. When 56 cents of every dollar is spent by somebody over age 50, that's about 40% of our GDP. And more importantly, older people pay taxes too. We often think that they're just getting Social Security and Medicare, and granted, we've paid into that our whole lives. About 40% of taxes are paid by people over age 50, and they can be a powerful force in driving the economy. They're also, more and more people are in the workforce longer. So we have almost twice as many people in their 60s who are working today than did in the 1990s. So more and more people are working longer. A piece of that is that people love their jobs and want to continue and find value and purpose in the work that they do. And another piece of it is there's a lot of people who have to work because they've not been able to save, or don't have the resources beyond Social Security and need some other source of income. One of the things that we've been trying to do is make sure that that employers look at older workers for the valuable asset that they are. Too often, as we age, the age discrimination pushes people out of the workforce or makes it much harder to get a job. So we've been working with over 100 employees on a project that looks at the multi-generation workforce. And we found that that employers that have mixed age teams, where you have people from multiple generations, are actually more productive. So there's sort of a, a, a power to have the wisdom and experience of an older woman, or older worker, alongside of younger people who may have new ideas or use technology in different ways. So we talk to employers about the benefits of a multi-generational workforce, the fact that we're going to need more and more workers as the labor market contracts with the aging of the population and lower birth rates, and just the value of having a workplace that represents the consumer marketplace. So I was actually speaking at a conference called Women in Retail. So these were some of the big retail firms all over the country, and that really resonated with them, that they needed to think about their consumers, but they also needed to think about their workers and the things that we go through as we age.
Mhm. And what is the best financial advice you could give to those who are approaching retirement? And should they or us, we, be worried about Social Security?
So a couple pieces of financial advice. When you're young, save as much as you can. When you're older, save as much as you can. But also make sure you didn't lose any of that savings along the way. Many of us may have had 4 or 5 jobs over the course of our life, and there might be retirement accounts that you've completely forgotten about, that have been building up assets over time. Trillions of dollars are lost in these accounts that the employer is sitting on, but doesn't know where the worker is anymore. So that's a key area. Look at your expenses. Look at your housing. Look at the cost of living in your area. Make sure you understand your budget. Make sure you understand, even before you retire, what your Social Security check will be. Social Security checks go up every year that you don't take them by about 8%. So if you wait to take your Social Security instead of at 62 and take it in your 70s, you have almost a 77% higher Social Security check. So making that decision is a really important one of when you're going to claim benefits, which may be the year you stop working, or if you can, wait as long as possible. I'm seeing a lot of families move in together to both help provide care, whether it's a grandparent taking care of a grandkid, or a adult child taking care of their parent. And that can be financially helpful for the families too, where they can share expenses. So there's a variety of things to do as you age, but making sure you have money beyond Social Security, that you know where it is, and that you make good decisions in when you want to claim.
And that takes us to the caregiving. You started talking about multi-generational families. How should families plan for providing care, budget for long-term care, and give us a picture of what caregiving looks like in America?
Pretty much, if you haven't cared for somebody, you probably will at some point in your life. As I said, I saw this close up with my mother, with 50 years of care, and my grandmother lived in our home for most of that until her last few years, when she was mostly bedridden, and no longer could my parents take care of her. But my mom still visited her every day in a nursing home in our little community where I grew up. The the truth is, we don't have a great system in this country for long-term care. So if it really pushes back on the family to figure it out, and the costs can be enormous. 1 year in a nursing home is about $100,000. For memory care, I was talking to several people a few weeks ago. Around here, it was $200,000 a year. Um, and so many times, people who are caregivers have to quit their job, in order to do it full time, because the cost of care is so high. We need a better system in this country. Medicare only pays for short stints after hospital stays. Medicaid, in most states, are starting to do more care in people's homes and communities where they want to live, but is required only to do nursing home care. And you have to have almost no assets and very low income in order to qualify for Medicaid. Um, some states, like Washington State, are starting to look at ways to create programs across the state to help caregivers by um, having a pool of funds that they can draw from, either to pay a loved one or to hire somebody or even to modify their home. So I'm hopeful that we can be doing more. I'm a little worried that there's a lot of conversations about cutting back Medicaid, and what the implications, particularly to people who get care in their home and communities.
One of the questions addressed the dreaded issue of death and dying, and you spent quite a bit of time in the book talking about preparing for the inevitable death and dying and end of life care. What are the key takeaways?
So this was my favorite chapter to write and to research, because I admit it, I knew very little going in. And so I wanted to know, how many people die quickly? And, what's the odds that I can die quick and painless? Unfortunately, that's not great. It's only like 15%. I wanted to know, what's it like to be with somebody who dies? So I interviewed a palliative care nurse, and just to explain what what happens to our bodies as we die, and how do people know when you're close or not close. And then I also, had some ideas that I was going to put in the book that I learned that were wrong. I interviewed Dr. Diane Meyer, who's a palliative care expert, a MacArthur genius. And I said, Diane, everybody needs an advance directive, right? And she said, we just did research that shows that they largely don't work. People don't follow them, and they can actually be harmful because when you're young and healthy, you might check a box that says, don't put me on a respirator. And then COVID hits and you go on a respirator or you die. And you don't realize when you're 20 that you can actually come off of a respirator at some point. And so what she recommended was having a trusted contact, somebody that could help make decisions for you, and make sure that given the situation would maybe have different answers depending on your health and needs. The most fun part of my job, Helen, is that I do all of our global work at AARP. So we look at what other countries are doing and we try and steal good ideas from them. So I was in New Zealand trying to understand how they help their Maori population, their indigenous population, with their healthcare system, because they were doing some radical changes. And I grew up in Eastern Washington near the Colville Reservation. So I wanted to know how we could help our own indigenous populations across this country. And while I was there, I got to stop and meet this woman, Katie, who started the Kiwi Coffin Club. And I think we need more of these across the country here. The Kiwi Coffin Club was part social network, part arts and crafts, and part philanthropy. So this group of people got together and they decorated their own coffin. And they had stencils and they had paints, and they had a coffee room nearby where people would hang out with books and games. And they also would decorate and donate coffins to children with cancer, or families that couldn't afford it. And what I liked about their attitude was taking death on and making it their own. One of the women had painted her coffin with scenes from hikes that she had gone on throughout her life, her favorite hikes in New Zealand. Another one did an Elvis coffin, because that was his favorite. And I think we often believe that people don't want to talk about death. And both in the survey, particularly for people in their 70s and 80s, they're very comfortable. When I was doing this book, I also interviewed my parents on all of these issues, which was incredibly eye-opening for me and led to a lot of insights about what my parents thought and what they wanted. I had asked my mom what she wants for her funeral. And at first she sort of demurred and said, whatever you and your brother want to do. And I was like, are you sure? She's like, yes, whatever you want. And then I pushed her a little bit to see. I said, we what we want is what you want. And then she opened up with a big smile and she said, really what I want is 2 funerals. We have a family burial plot on one side of Washington State. We live on the other Washington State. And she didn't want people to have to travel in between the two. So she wanted one in each location, so that people could be there without having to travel too far. And so now I know her wishes. It was a real gift, that conversation that we had.
That happens to be my favorite topic as well. I love talking about different, and also studying different traditions. You mentioned that indigenous people have a very different from the Western mind attitude toward death and dying. It's usually a part of life, part of the ceremony. And it's always, like you were saying, it's a ceremony let's say, decorating your coffin or talking about it. But since childhood, you become a participant in the process of dying. So I just had a session with an Indigenous healer on this for geriatric psychiatry. So I appreciate the wisdom.
Tell me more. What did they say? What were some of their
He
traditions?
took us through the ceremony of letting go, and they generally don't believe it was one of the uh, Indian tribes. He was a practitioner there in Phoenix, Arizona. And he took us through the ceremony that goes around burying somebody and celebrating the life. And I can share more about that with you later, but we sure have to learn from the indigenous people about how to value life and death, and that it's not just the celebration of birth, but also a celebration of death, the beginning and the end of life.
Well, and I think we also need to give people the opportunity to talk when they want to talk. Just giving my mom the open. She was afraid of saying something that might offend me. I was afraid of saying something that might offend her. When we both talked about it, it was sort of a huge relief for both of us. So again, I learned a lot from that chapter and just had a lot of questions, from my own future and death, or being with somebody who's dying, how do you support them? All of those things. So I learned a lot through that one.
We're so terrified of talking about it, as you said. We need to get comfortable, and intergenerational families teach you that, making workforce more intergenerational and caregiving more intergenerational, giving back and forth between the generations, I think would bring about more comfort about thinking and talking about death and dying.
I agree. And again, we're often a distant families from people are distant from their core families. Many people die in hospitals rather than in the homes the way they traditionally did. But I think it's still a important conversation, and understanding really what are your wishes and what is important to you at the end of life. Again, I think that was Diane's point too, is having those conversations so somebody can represent you is more important than a piece of paper.
Mhm. So what do you think if you had a magic wand, what would you do, or would you change first order of business to improve lives of older Americans?
Well, I wish I had a magic wand, especially right now. So one of the things I talk about in the book, You're Lucky You're in California, is the fact that we have no national plan on how to deal with demographic change. We talk a lot about climate change. We talk a lot about AI, but we do very little about demographic change and the impact of that even on our housing systems. We have very few houses that are designed for us as we age. Most of them have stairs like my house. We don't have a system of long-term care. We're not investing enough in lifelong learning. We need to make sure we have more geriatricians and geriatric specialists like you, Helen, to provide care to the growing aging population. So my magic wand in the book is to have a national plan on aging. I said you're lucky in California because several years ago, California adopted a state plan on aging. And it's helped to redirect resources and invest in communities in broad ways. We need to see that at the federal level as well.
Would you say that ageism is still at play in this barrier in developing such a policy?
Ageism is a piece of it, and it's also demographic change is slow moving. And people, again, it's affecting everything everywhere all at once. So a lot in having worked in Capitol Hill, people look at things in silos. So they think aging is a health issue when it's a housing issue, a transportation issue, a workforce issue. And so there's a lot of blind spots, I think, and then there are areas where I think we're just not focused on because it's something that we're scared of ourselves. So things like long-term care, it's hard to get members of Congress to be thinking about the need for care beyond medical care. And the costs of a lot of these things are high. And so figuring out how to pay for them and make the investment is always a struggle.
So overall, what is your prediction in terms of the effect on economies around the world and also in the United States?
So we're seeing aging isn't just happening in the United States, it's happening around the world. And we're going to see actually a doubling or quadrupling of the population by 2050 of older people. Next week, actually, I'm headed to Rome for a conference with the Vatican to look at global aging and dementia. We had hoped it would have been with His Holiness Pope Francis, but we are excited that the conference is still going on, and we're bringing leaders and from all over the globe together to talk about aging. One of the things that most people don't realize, and I don't think I did until a few years ago, is the massive growth in aging population that you're seeing today is in developed countries like the United States or Europe or Japan or Singapore, or some of the Asian countries. Where aging is going to happen going forward is in lower and middle income countries. 80% of older people by 2050 will live in lower and middle income countries. And they're going to become older very, very rapidly without the kind of infrastructure that we've built. If you think of traveling around the world, one of the things that we are advantaged here in the United States is the Americans with Disabilities Act. That was put into place in the 90s and means that we are able to use facilities, and stairs have curb cut, or stairs have ramps, and corners have curb cuts. Most of the rest of the world doesn't have that. And so thinking ahead at things like infrastructure, making sure that healthcare systems are focused on a growing aging population. Those are all things that we've been pushing with, like, the World Bank and the United Nations and others. Try to have sort of a wake-up call that this is coming.
Thank you very much. So we're going to turn to our attendees with questions. Before we start, do you have anything else as a concluding thought for this portion of your presentation?
No, I just appreciate everybody coming out tonight to listen. I get a little wonky, but happy to answer questions. And I will tell you, if I don't know the answer, I'm not going to make it up. One of the things that was really important in the book, that everything I said was based on sound research and evidence.
Yes. Mr. Dean is asking, could you please go a bit more into how individuals who do not use hearing aids can see a decrease in cognitive health?
Oh, good question, Joseph. I know the top lines of that study, and we have what's called our Global Council on Brain Health, which is a group of experts all over the world that we pull together to look deeply at issues. So if you type AARP, GCBH, or Global Council, and hearing aids and dementia, there'll be a lot more information, but it increases your risk, and I'm not going to give you the number because I don't know it off the top of my head, substantially, of having untreated hearing loss. And I think it's because of this. If you can't hear, you become more isolated. And you're not using your brain in the same way I was talking about. People become withdrawn, they don't go out as much. All of those things are really, really bad for your cognitive health. But I encourage you to look up that report, and more importantly, everybody get their hearing checked.
Not just hearing, but also vision. Any sensory deprivation would lead to cognitive decline. Exactly for the same reason, you would be more isolated and less stimulated by environment. The next question is about importance of the relationships. I've heard that it's important to have at least one close friend other than your spouse. But also you cannot have more than 10 close friends. You get your time too diluted with greater than two persons. Any thoughts about that?
Well, I'm going to have you answer this too, but from what I've read, you can have no friends and not be lonely and isolated, or you can have lots of friends and still feel lonely and isolated. And what's toxic is that feeling of not being connected to people. Helen, what do you have to say?
Yeah, loneliness, right. No,
Yeah.
this is actually my second favorite topic about loneliness versus solitude, where solitude is sought and cherished and enjoyed, and loneliness when you feel alone, not supported. And one of the solutions to loneliness is to teach people to enjoy and cherish solitude. That's sort of my thing at the moment.
I've also I also spoke to an expert who said that you don't even have to have a close friend. It's that feeling of connection to others. So even talking to people at the checkout line, she was counseling people who may be homebound or have a difficult time even leaving their house, even just waving at people on the street. And feeling connected, or having a phone call or a Zoom or other ways. I think we all had to learn during COVID of a variety of ways to connect, even when you couldn't see each other face to face or touch.
And yes, I had to move all my studies of yoga and Tai Chi to the Zoom, which was not organic to us, but we got used to it.
Yeah,
And in fact, there have been studies of Zoom versus in person, and no difference in terms of the sense of
really.
loneliness. Yeah.
Because I would have thought that little chatting at the end would have been, more connection than what you can get off a Zoom with a whole bunch of
Right.
people.
People have preferences, of course,
Yeah.
Yes. All right. So importance. Seems more people are putting off retiring due to financial needs. Is this a good thing for mental health? In that you're keeping busy and keeping relationships with coworkers, or does it add to stress and can accelerate mental health problems?
So it depends on the work, and it depends on what you do when you're not working, I guess is is the easiest way. So if you stop working and we're active and are sedentary, that can increase your risk for cognitive decline and dementia. But there are lots of jobs where you don't use your brain. And there's lots of jobs where you maybe use your body too much and are not physically able. And so I think the the demands of work can vary a lot. And also you may have lots of friends at work, or you might feel lonely and isolated there too. Um, I talked to one woman who left her career because there was kind of a mean girl situation of the younger ones saying she couldn't learn or be helpful. She was worked in a dental office. And unfortunately, she had to keep working because she needed the money. And so had then a job where she was standing all day, which was really stressful for her. I will say, the seeing the rates of work go up, and seeing the rates of work for gig work really go up recently, I think is a mix of that financial and connection. So hopefully that helped you.
So a few questions are related to sex differences or gender differences in this ageism, or trying to find a job, or even economic financial literacy in women. That it's harder to find a job if you're 50 plus, especially if you're a woman. Financial literacy has become more important for all of us, and women may be at disadvantage in this.
So women have advantages and disadvantages. On average, women live 6 years longer in the United States. So we live longer, but women have earned less our entire lives. Um, for Hispanic women, over the course of their lives, they earn $1 million less than white men. We always talk about, what's the hourly difference that they make, but when you add it up over a course of a lifetime, it's really, really huge. So we live longer, we have less financial resources, we probably took time out for caregiving. Um, and so all of that really combines. The specific question about looking for work is also, it does get harder. And so there's an intersectionality between ageism and sexism. And then also, if you're a woman of color, of racism. So they've done studies where they sent resumes to potential employers where the differences were by age, and they found that older men had less callbacks than younger men, but older women had much less callbacks than the older men, and older women of color had even fewer callbacks. And it gets worse and worse the older and older the ages were. So we do have a problem in this country where people who want to work and who need to work can't find good jobs because people won't hire them. AARP has been pushing to strengthen the age discrimination laws for many years, which were weakened by a Supreme Court case, making it really hard to prove that the reason you didn't get a job or that you were let go was age discrimination. So as we have an aging workforce, this is something that we really need to take serious, both on a legal side, but what I was trying to talk about is work we're trying to do on the positive mindset of seeing the value of having older workers and experience too.
What do you think about Medicare vis-a-vis getting enough or sufficient care? One of the questions relates to group therapy, for instance, for seniors that is covered by Medicare, or for women as they navigate through the transitions prompted by menopause. Is there sufficient Medicare coverage of the services?
And I'm sorry, I didn't hear the first service you mentioned.
A group therapy or
Group
support
therapy.
for women going through menopause and after?
There's not enough mental health coverage in Medicare. One of, again, given I shared my story of my grandmother, one of my proudest moments was working in the Senate on mental health parity to try and make sure insurance companies would pay for mental health the same way they paid for physical and other health issues. That was passed for private insurance, but wasn't initially applied to Medicare. And so there's still some treatment limits within Medicare, and many of the many insurers don't have a robust network so that people can find mental health support. And Helen, I'm excited to meet you because there's very few mental health workers that specialize in older persons. And you can correct me if I'm wrong, but far too many doctors who may be seeing somebody who is depressed just think that's a natural part of aging rather than something that's treatable. So we need to both improve the availability of care, but also, sort of remove the ageism and stereotypes that older people should be depressed.
Yes, it's been a journey, but I think the medical profession is coming to the terms ever since we asked them to screen for depression, primary care physicians. It took 20 years to implement. So at this point, patients are screened for depression more or less, but then what to do with this is another issue. And the aging workforce in healthcare basically is a problem. And finding a pipeline or solution, creative solution to create a workforce that would be effective in providing mental health care is something we're working on. I'm a past president of the American Association for Geriatric Psychiatry, and we are developing all sorts of certificate programs to train other professionals. So it's ongoing, but it's unresolved at the moment.
Are you finding any students go into the profession?
No, I mean, again, it's ageism, the barriers that we're trying to break. And we feel that more junior students have to be exposed to geriatric mental health and geriatric care in order to warm up to the profession and the population to serve. And that's what we've been doing, bringing in undergraduate students, medical students, as early as possible, even high schoolers. I mentor high schoolers to expose them to the and people who are attracted to this is like yourself, somebody who had grandparents they dealt with, and it opened their hearts to the population. So we're approaching the end, but there are a number of interesting questions and suggestions. Something that addresses how to preserve our money throughout our lives, because we're
Oh,
all
I see the
exposed to the volatility of of the markets.
Yeah, and I will just want to be clear. I was saying don't lose your like lose the account where you don't know where the account is. I wish I was such a great economist that I never lost money in the stock market. What I don't want people to do is put money away out of their paycheck and then leave it somewhere and never have it when they actually need to draw it down for retirement. And again, because we have many jobs in our life, many times we have like 3 or 4 or 5 retirement accounts. So that's what I meant about not losing money.
So this is the question that we could clarify. The conundrum is that healthy living leads to longer longevity. That's what we're talking about. But research shows that longer longevity potentially leads to chronic disease, pain, cognitive problems due to wear and tear, cellular deterioration. And furthermore, the last 2-3 years of a person's life can consume 70 to 80% of total medical costs of their lifetime. Can you explain this a little bit? I think Healthspan comes in here.
Yeah, so lifespan is how long we live. Health span is how long we live without major chronic diseases. I actually don't love that definition because most of us live with chronic disease for long periods of life, and many of us are born with chronic diseases. So it's a little bit off, but the idea is how can we have fewer years of unhealthy aging and more years of healthy aging. And so we extend our health span, not just our lifespan, because nobody wants to live sicker from decades and decades. Yes, there's also we will have chronic diseases. So even within the chronic diseases, how can we maintain what health and capacity that we have for as long as possible? We didn't get Helen into the whole geroscience discussion. There's a lot of science being developed that can try and at the cellular level slow down the process of aging with that goal of not living more years, but more healthy years. But eventually we will die of something. And even though I ask questions, how long will I live? There is no answer on page 34 for each of you, unfortunately. And in fact, I do share a really personal story that my husband had a massive heart attack at age 46. And he was a really healthy and a lifelong athlete. And so good health and longevity may not be perfectly correlated. There was no signs before his heart attack that he had any issues other than a little bit of cholesterol. So the our lives, each one of us will be different in many ways. And one of the things I do try to capture in the book are patterns that we're seeing by race, by gender, by ethnicity, by geography. Where we live is now more important to our health and our lifespan than our genetic code. Our zip code is more important than our genetic code. So these are some things that that I think a lot of people don't realize as we age become more and more important.
Yes. And anything about the value of 55 plus communities?
Um, I think back to the conversation about loneliness and isolation, a lot of people move to those to find friends and people like them. They are designed in a way that they're more and more accessible. Many communities also offer a range of care for individuals. And so I think there's growing more and more housing options for people, but we still need a lot more given the aging of the population.
I think we're out of time. There's quite a bit of questions about psychedelics and cannabis use or smoking to relieve some of the symptoms. I just answer to all that that's controversial, and there's not a lot of data for some pain management or mood management could be appropriate, but generally not. Drug use will contribute to cognitive impairment.
Well, Helen, thanks for being in conversation with me. Thanks to the 500 plus people that listened in, and thanks for all the work that you do.
Thank you so much.
I would like to thank you both. This was really an enlightening and inspiring conversation, and you gave us so much to think about and unpack and incorporate into our lives. So we're very, very grateful to both of you for sharing your knowledge and your expertise with us. And I want to thank everybody who tuned in today for the privilege of your time. And in closing, in summary, just to Deb's points for healthy aging: eat well, exercise, don't smoke, don't drink too much, use your mind, keep a positive mindset, find purpose. I think those are all just gems to think about and try to live by. So good night, everyone. Stay safe, stay well, and have a lovely evening. Good night.